A brief presentation on the science of learning. Its purpose is twofold. The first is to help you retain and acquire the information and skills from the high velocity, low amplitude thrust manipulation course that is a part of the clinical residency. The second is to teach you on how to continue to acquire information and even help you with the upcoming OCS exam that you'll likely take in 6 to 8 months from now. So there's 4 objectives. You'll be able to identify the myths of current learning so that you can avoid these pitfalls, recognize the benefits of the flipped classroom model, define 6 different evidence-based learning strategies and cognitive techniques that are used within the literature, and then be able to implement these strategies to learn the skill set and the knowledge, the implicit and explicit knowledge of the high velocity, low amplitude joint manipulation skill. So the myths of learning. A quote from the book, Make It Stick, by Brown et al. People generally going about learning the wrong ways. And the myths that I present in the coming slides are so that you don't fall subject to these common beliefs as you continue to study within the residency and thereafter. So the first myth. Rereading text and mass practice are helpful in learning and memorization of materials. This, in fact, is false. Rereading text and mass practice is actually one of the least productive study strategies, despite how prevalent it is within formal education and learning strategies for students. Okay, second myth. You learn better when you receive instruction in a form consistent with your preferred learning style. This, in fact, is not the case. Teaching based on one's learning style is not supported by empirical evidence. Conclusions by a recent systematic review that considered this. Learning styles do not work, yet the current research literature is full of papers which advocate for their use. These papers advocating for their use are based on theory and they're anecdotal in nature. And despite that, there's a consistent utilization of the learning style as a teaching strategy. And this undermines education as a research field, and it also likely has a negative impact on the retention and teaching strategies for students. Familiarity with the material leads to better recall and learning of material. So this is, in fact, false, and it actually leads to the illusion of knowing the material. We're actually very poor at determining when we're actually effectively learning and rather just becoming familiar with a text or material that is presented to us. This includes rereading either the text itself, rereading highlights, and or re-listening to lectures. Frequent low-stakes testing helps to calibrate our judgment of what we've actually learned and is a proven-out strategy to overcome this illusion of knowing. In virtually all areas of learning, you build better mastery when you use testing as a tool to identify and bring up your areas of weakness. Learning materials should be designed in a way that decrease unnecessary demands on working memory. This is also false. Material designed in a way that provides a higher demand on working memory, though it's counterintuitive, such as the term is disfluency, with the initial exposure to the information, leads to better learning outcomes. An example of this would be reading a text in a hard-to-read font. Even though seemingly in the moment, it's maybe frustrating and difficult to decipher, more so than an easier to read font. The additional concentration and focus that you put forth in trying to retain the information actually leads to better recall and better retention. Okay, it is better to be taught how to solve a problem prior to attempting to solve the problem independently. This is also false. Trying to solve a problem before being taught the solution leads to better learning, even in the instances where errors are made in the initial attempt. And this actually gets to the point of generation, which we'll talk about in coming slides, as far as being able to generate and troubleshoot independently will actually help when you're provided the answer or guidance thereafter. Okay, there is a limit to how much information that we can learn and retain. This is false. If you practice elaboration, there's no limit to how much you can learn. Elaboration involves connecting new information to pre-existing knowledge. So having a mental model of the area of discipline or study, and where you can actually take new information in and connect it to those facts in that model that you already have, then you actually can have a consolidation of the information, allowing for greater bandwidth and more potential for additional factual information to be learned. You can think of the mental model as a scaffolding of your brick and mortar building before it's being built. And then each brick within the building is a new fact that you learn. And so the example would be you can either be left with a pile of bricks, or you can be left with an actual building and structure that there within you can continue to elaborate upon it. Some quotes surrounding elaboration. Anderson in 1983, one of the most potent manipulations that can be performed in terms of increasing subjects' memory for material is to have the subject elaborate on the to be remembered material. Hirschman in 2001, a conscious intentional process that associates to be remembered information with other information already stored within the memory of the individual. Now out of the myths and into the benefits of the flipped classroom model. The operational definition of a flipped classroom model, for those who aren't otherwise familiar with it, is where the learner is exposed to the information prior to the scheduled learning session, and then once they're actually in the class or the scheduled group session, then they actually interact, analyze, and apply the information that they've learned independently. And that is in opposition to the traditional learning model where, in fact, you sit in lecture and then you go home and study it and try and apply it to different problems or problem sets within a textbook or assigned assignments. So a good quote from Dr. Marshall from the University of Rochester in a speech she gave on the flipped classroom model in 2015. Flipped learning is robust instruction made possible by leveraging technology to create fertile spaces for teaching and learning. Okay, so what does the research have to say about the flipped classroom model? This is a meta-analysis that was done in 2018, specific to health professions education. 28 studies comparing traditional versus flipped models. Overall significant effect in favor of the flipped classroom model over traditional classrooms for health professions education. You can see the standardized mean difference in the statistics shown there. There's no evidence of publication bias within any of the 28 comparable studies. The flipped classroom approach was more effective when the instructor used quizzing at the start of each in-class session. Other conclusions from prior systematic reviews and meta-analyses to date. Current evidence suggests that the flipped classroom approach in health professions education yields a significant improvement in students' learning compared with traditional teaching models. Repeated use of flipped classroom in a curriculum are recommended to make effects of positive metacognition and collaborative learning strategies sustainable. So what this means is that across the particular curriculum or within a semester of a particular course, consistently utilizing the flipped classroom model versus your traditional model helps with the development of metacognition of the learner, as well as collaborative learning strategies amongst learners. When you ask the students as far as their perspective of the flipped classroom model, it's overwhelmingly positive in comparison to the traditional model. Medical students have generally expressed strong satisfaction with early application of flipped classroom, in contrast to the undergraduate medical education, and generally prefer this method to lecture-based instruction. Okay, this being said, it is a relatively new field and will continue to rapidly develop, as will the technology making the flipped classroom model feasible. Here are some other conclusions that have been drawn from other systematic reviews to date. More solid evidence on its effect, that is the flipped classroom model, and its changes in knowledge and skill are warranted. Further studies should also examine the long-term effects of the flipped classroom with regards to knowledge retention and transfer of knowledge to professional practice and patient care. And then the different means by which it is carried out. So varying methods of implementing and studying the flipped classroom in general medical education has led to variable results. Approximately half of the studies comparing the flipped classroom to the traditional classroom in this systematic review reported better achievement under the flipped classroom design. So really what this author's touting for is more standardization in trying to optimize the flipped classroom so there's better homogeneity in the application of the flipped classroom. Despite the heterogeneity, it's consistently showing benefit in half of the studies included compared to the traditional model. All right, let's talk about the science of learning. Learning is deeper and more durable when it is effortful. Science of learning. Okay, so here are the 6 principles that I'd like you to take away from this lecture. Retrieval practice, space practice, interleaving, generation, variable practice, and reflection. I'll define each of these. Retrieval practice, bringing learned information to mind from long-term memory. It's essentially trying to remember someone's name or definition, any piece of information that you've otherwise previously memorized or known, and you have to then recall it and apply it. Space practice, creating a study schedule that spreads study activities out over time. Interleaving, switching between topics while studying, versus the opposite would be a blocked practice schedule. Generation, producing material during learning improves later memory performances. This is the example of not having the answer provided for you, but attempting to generate answers and hypotheses prior to being provided the answer, even if you're off. Variable practice. Fluctuations across repetitions during performance of a particular task. Variable practice is seemingly similar to the interleaving. The difference predominantly is in motor learning, where the variable practice is where you're performing 1 or maybe even 2 repetitions and then moving on to a different scenario. Reflection, serious thought about one's character, actions, and motives. Okay, so these are the 6 components and techniques that I like to employ to help facilitate your learning with the high velocity, low amplitude thrust mobilization lecture and lab. Retrieval practice, space practice, interleaving, generation, variable practice, and reflection. Okay, so all this information is good, but it's only theory. How do we make it practical to help to facilitate in the growth of your learning? So the first is what I like to propose is that we incorporate a flipped classroom model and have you review some material prior to the joint manipulation lecture and lab. And I'll explain more about how we'll incorporate this. Additionally, within this pre-learning material and engaging with it, I'd like you to dabble with the retrieval practice, space practice, interleaving, the generation of the hypotheses and troubleshooting, variable practice, as well as self-reflection. Okay, and then when you actually come to lab, we'll actually be able to apply the information and put it to practice. Okay, so here's the challenge that I have for you. Between now and the HVLA lecture and lab, approximately 8 weeks, I want you to watch some or all of the instructional manipulation videos that I send. So you'll see in the email, there's a hyperlink to a playlist on YouTube that is private, and that you'll be able to look at each of these different manipulative videos, and they're labeled by the different spinal regions, etc. And so you can view some of these, you can view none of these, you can view all of these, but it's meant to provide you some helpful guidance while you perform. The next component is performing 60 spinal manipulations on patients, colleagues, friends, etc. over this 8-week time frame. So that's less than 10 manipulations per week, and seemingly that each manipulation takes less than a second, or should take less than a second. Then I think that that's ample time though it will take some scheduling on your part. And to that end, I think that you should have your scheduled practice be distributed across the cervical, thoracic, and lumbar spine regions. These can include the upper cervical spine, lower cervical spine, CT junction, upper T-spine, lower T-spine, L-spine, and the sacroiliac joint. I also want you to keep track of your performance with a scorecard. That's also an attachment on the same email that you received this lecture in. You'll be asked to present this scorecard on the morning of the HVL lecture and lab. There's specific instructions about the scorecard on the scorecard itself, so I encourage you to open that up. There will be a pre-lecture assessment of these techniques prior to the lecture and lab, where you'll actually be asked to perform up to 3 to 5 of these different manipulations on one of the instructors prior to the actual initiation of any lab or lecture content. Apply the learning techniques as follows. So now I'm going to give you some strategies on how to employ the 3 different cognitive and learning strategies. Okay, let's talk about retrieval practice. So remember, this is recalling things from memory. When performing the cervical spine HVLA, avoid referencing material while practicing. This would be an example of retrieval practice. Attempt to recall the parameters of cervical rotation towards, side bend away, and the side guide toward the direction of the thrust. And then apply a PA to the targeted segment. So looking back at notes or reference material that would otherwise provide you the sequence in which you would apply these components and parameters would be not in line with retrieval practice. And you'll also find that this information is explicit versus the implicit. To differentiate those, explicit is that you can verbalize the knowledge. Implicit is that intuitively you know, and it's more difficult to verbalize implicit knowledge. It's essentially the feel of someone's neck in your hand as you find the different vectors and components. Space practice and how you can apply this. Create a HVLA practice schedule. Leave adequate spacing between practice sessions, approximately 24 to 72 hours. Make the duration of the scheduled practice sessions feasible and sustainable for your busy schedules, both clinical and residency responsibilities. So maybe you're only practicing for 20 to 30 minutes at a time, but you're spacing it and distributing it throughout your week. Span the practice schedules out over sufficient amount of time ahead of the HVLA schedule or the scheduled lecture. And so you have 8 weeks, and you can do this across the 8 weeks. You can do this across 2 weeks. 4 to 6 weeks would be ideal for adequate practice time, in my opinion. Okay, that brings us to interleaving. So spinal manipulation, high velocity amplitude application. So in a single practice session, perform the HVLA technique on a different body region. Upper cervical spine, lower cervical spine, cervical thoracic junction, upper T-spine, lower T-spine, the costovertebral joints, lumbar spine, sacroiliac joint. Perform no more than 3 repetitions at a particular body region per practice session. Note, by doing this, you are likely going to have a sense that you are learning slow and that your competency is not accelerating at a rate that you otherwise would like or expect. Your performance is going to be lower than what you would like. Trust in the process. Consistently interleaving is superior to blocked and constant practice. And you'll likely have a better result in the lecture and lab and a better experience and competency if you follow this rule. Generation. So during a practice session, if the specific means by which a technique is described is not working for you, Then generate alternative strategies to apply the thrust with the appropriate velocity and desirable vectors. This may fluctuate based off your body size in relationship to the patient or the individual, and this may be dependent on the individual's body size. How else can you apply the same thrust and the necessary force in the appropriate vector or direction in order to get the same outcome? Again, generation is trying to solve a problem before being taught the solution, and this leads to better learning even when errors are made in the attempt. As frustrating as it may be to make errors, it's inevitable, and it's actually a product of pushing your limits, which this effortful pushing of your limits will lead to more robust learning. Variable practice. Practice on the spinal manipulation techniques on a variety of different body types, sizes, persons with symptoms, person without symptoms. Try the cervical techniques at different levels. Try the T-spine techniques at different levels. Try it with your left hand. Try it with your right hand. And try and consistently vary the practice from one repetition to the next. Reflection. So during, after, and between practice sessions, ask yourself, and maybe even take notes and write these things down. What went well? What actions did you take to facilitate the positive outcomes? What didn't go well? What can you do better next time? Are there patterns or themes across practice sessions that you're noticing? Are these good patterns? Are these ideal patterns? Are there patterns that you want to change? Seemingly using video as well as photo are really helpful in the processing, in the reflection process, particularly for this skill, and I encourage you to utilize them. Granted, it will obviously likely require you having another person there to film. And is there anything else that you need to learn in order to increase your mastery of the particular technique? And seemingly you'll get more information on each of these techniques within the lecture and lab session. Okay, not one of the 6, but definitely deserving of some time and attention is deliberate practice throughout all of your practice sessions. Deliberate practice of skills is critical to progress from the cognitive to the associative phase of motor skill learning and to develop expertise. In deliberate practice, components of the skill are practiced. The learner's performance is assessed either by themselves or someone else. They're provided specific, informative, either self or peer-provided feedback that in turn leads to more skill performance. With deliberate practice, learners develop a mental representation of the skill, and it allows them to refine and improve their performance, not only during, but also with cognitive rehearsal of the practice. So this enables mental rehearsal as well as physical rehearsal improvements. This being said, this also is the caveat to the 10,000 hours rule. 10,000 hours of performing a particular skill or task does not make you an expert, where in fact 10,000 hours of deliberate practice is the differentiator. The more specific you can refine these skills and the components they're within, the more successful you will be at learning them and retaining them for the long term. Okay, in conclusion, hooray for the power of self-learning. Some summary statements. People generally are going about learning the wrong ways. Learning is deeper and more durable when it is effortful and you work for it. We are poor judges of when we are learning well and when we're not learning well. The popular notion that you learn better when you receive instruction in a form consistent with your preferred learning style is not supported by empirical research. However, each of the techniques presented within this lecture have robust empirical evidence to support their utilization across all learning styles, regardless of how you perceive yourself to best take information in. The science of learning has made a considerable contribution to our understanding of effective teaching and learning strategies. And using these techniques is implementing the theoretical science of learning and implementing it into practice. The 6 specific cognitive strategies presented have received robust support for decades of research. Okay, just rehashing the objectives. So we talked about the myths, the benefits of the flipped classroom model, the 6 evidence-based learning strategies, and implementing the evidence-based learning strategies for the high velocity, low amplitude joint manipulation techniques. Feel free to reach out with your comments, questions, and concerns. Thanks so much for listening, and good luck on your challenge.